This lecture is divided into 4 segments, and timestamps have been given in the description for easy understanding. The first segment consists of exceptional cases or exceptional conditions under which there is tamponade but no tachycardia, because generally, when there is tachycardia, there will be cardiac tamponade due to JVP distension. So these conditions under which there is tamponade but no tachycardia are hypothyroidism conditions like in myxedema. The second is uremia. The third is patients on beta blockers. And the last is end stage conditions of cardiac tamponade patients. The second segment is about blood pressure that has been discussed previously while explaining Frank-Starling law, and video link has been given in the description. The third segment is about chronic conditions occurring under cardiac tamponade. The first condition which will occur is dyspnea, which is the main sign of cardiac tamponade patients. Other conditions like hepatomegaly can also occur. Ascites is also a main feature, chronic feature of cardiac tamponade, which has been brilliantly explained by osmosis channel. And in addition to these, systemic edema can also occur. And under all these conditions, heart failure features will be shown in cardiac tamponade patients, which is the main feature of cardiac tamponade. And the last segment is about clinical features which cardiac tamponade patients show. First is hemodynamic instability, meaning the disturbance of the dynamics of blood flow, meaning the showing of Beck's triangle. The second is about underlying conditions, meaning if the patient has any underlying symptoms like tuberculosis, then tuberculosis symptoms will also be shown in cardiac tamponade patients in associated type. And the third is about acute pericarditis, which will be shown in the form of chest pain, pericardial rub, ECG changes, and evert sign. Thanks for listening.